Hey everybody, I'm joined here today with Dr. James Lin over at Glow Laser and Beauty Center. You can find them at glowlaserbeauty.com. So we're here to talk about their treatments for ED along with some of the main causes and the questions that patients usually have. So Dr. Lin, thank you so much for joining us today. Really appreciate it.
Well, thank you for having me.
Yeah, absolutely. And yeah, I wanted to start off just by asking about your experience working with these patients, what got you, into these treatments and being able to help them with this.
Sure. So I've been in practice for the last 15 years, and my primary practice is actually geriatric medicine. So I take care of individual over the age of 65 with chronic conditions, and that was my primary specialty as I started my career. And as I practice geriatric medicine, internal medicine, I realized that we're just treating a lot of times just the symptoms or the remnants of what things could have been prevented if we would have started 10, 15 years earlier for the patient. So I got interested in anti-aging medicine, integrated medicine, functional medicine, whatever you want to call it. And in addition, we got into aesthetic medicine. So all of those type of concepts are for prevention and rejuvenation purposes. And because I've seen the sick of the sick, it gave me a different perspective on, if we treated a healthy individual that's aging, how do we best prevent them from getting to the chronic state that they're in and eventually end up in a debilitated state or disabled state and then lead them to institutionalization. So that's what got me interested in sort of this realm. And as I learned about it, I've been in the business for aesthetic medicine and functional medicine, lifestyle medicine, we call it. We have a center for lifestyle medicine within Glow Laser Beauty Center. It's all about prevention. It's all about looking for signs and symptoms early so we can intervene and rejuvenate and regenerate disease state. So ED is a very common problem that we see in our population over the age of 55. It's oftentimes not talked about because the stigma of talking about sex when they come in and talk to doctors. So a lot of men are embarrassed to bring it up. And incidentally, sexual dysfunction is not just in men. Women are have sexual dysfunction as well. It's actually very common. Almost 50% of women do get sexual dysfunction as well. So we get asked, if it is brought up during clinic or in a primary care setting or in the aesthetic space, usually it starts with, they can't have an erection. They notice that the erection doesn't last as long, or they are not interested in sex, period. So a lot of times the partners will actually come in and tell us about that because the patient themselves are embarrassed. So we have, in our clinic, both in my internal medicine practice, geriatric, or in our wellness practice, we have screening questions so that it prompts us as clinicians and providers to bring the conversation up. And, the other thing is, I think there's ageism that comes with an older individual or older adults. Just because you're in your 70s and 80s doesn't mean you don't have sex. And it's just not talked about because either they can't have sex because of ED or they're embarrassed to talk about it. And doctors and providers a lot of times just assume that just because you're old, you don't have sex. And that's not true.
Mm.
So
Definitely. No, I think that's a great point. I think for, yeah, a lot of providers, they don't want to bring it up. And I think for patients, they might assume that the only options they have are, some of those PDE5 inhibitors, which, obviously can work for some patients, but have a list of side effects. And for some patients, they really, aren't a good fit for them.
absolutely.
And so, what are really some of the main treatments and modalities that you would focus on for a patient that's, struggling with ED and sexual dysfunction?
Yeah, so obviously we approach the patient, the same way as we would with any other conventional medicine, where we take a thorough history and physical on the patient, and certain causes of ED we have to rule out. So some of the common things that can happen and cause erectile dysfunction could be, centrally from the brain. It could be a hormonal imbalance. It could be nerve because of chronic disease such as diabetes, so they have neuropathy. And then finally, it could be, the muscle tissue itself, because over the years they could have trauma in their on their penis and things like that. And lastly, cardiovascular disease, right? So they sort of go hand in hand. What's healthy for the brain, it's healthy for the heart, it's healthy for the blood vessels, but then eventually the erection is caused by blood flow. So if you have, dysfunctional vasculature that could cause erectile dysfunction.
Definitely. So I mean, that really could be a good warning sign that they need to take a look at kind of their overall
Sure.
health.
So as we go through that and we sort of rule out some of these that potentially could cause erectile dysfunction, you come to find out that sometimes it's an emotional issue. They're depressed, and that needs to be treated. They're just struggling with stress. That needs to be treated. So it's a pronged approach. And then you get down to if they still they still have spontaneous erection, in the morning or throughout the day, you know that the organ itself is probably still working. It's just a matter of how do we get them to function more efficiently and try to help them as an adjunctive therapy. So a lot of these things is not a magic bullet. You need to do multiple things. You still may need to treat them with a pharmacologic agent like like a Viagra or like you mentioned. But with that and plus some sort of regenerative treatment such as a P shot, we could actually help them with sensation and sort of the whole experience could be a little bit better for them.
Yeah, interesting. Yeah, because I think, a lot of patients might assume if they're treating ED that really it's just going to be, the erection specifically, but it's interesting you mentioned its sensitivity and those other things. So yeah, it's good to know that they can have those other things as well.
Yeah.
And then for most patients, how long do you typically find that it takes for them to start seeing results and seeing some improvement after they do the treatments?
Yeah, so again, that all depends on sort of how long they've had ED and what the mechanism of their ED is. And if sort of a straight, we have patients that respond after one treatment. We have patients that need 3 or 4 treatments before they see an improvement. So I remember I had a veteran young man that came in, and he was a war veteran, and he got injured with a roadside bomb, and he had all kinds of neuropathic injuries after getting blasted, and he had multiple back surgeries and so on and so forth. And as a 30-something year old individual, he noticed that he just doesn't have as much sensation, and he noticed that he's not getting the erection that he used to. And in that scenario, I think is multi-pronged. He probably does have some PTSD where it causes depression, anxiety, and now he's home trying to adjust. And then the other thing is anatomy-wise, physiologically, with his nerve injury, that potentially could cause it. So that individual, we gave him 3 treatments and stuff, and it was only after the 3rd treatment that he started seeing a difference in terms of sensitivity and also the arousal part. He was able to improve on that so that it doesn't take him as long to get an erection, and he can actually have a relationship back with his wife in a meaningful way. So that was very satisfying on my part, actually, because we were able to help a young man like that. But other ones, our geriatric patients, the older patients, sometimes they just need a little bit of rejuvenation because the tissue is just a little bit old, and they need to sort of rejuvenate the tissue itself. So the PRP, which is what a P shot is, in case your audience don't know what a P shot is, essentially what we do is we come in, your patient will come in, we'll draw about 10 to 15 cc's of blood, and then we spin it down and we extract what we call platelet-rich plasma. And inside the platelet-rich plasma, we have 7 different growth factors that can help trigger healthy tissue to rejuvenate and regenerate. So we essentially inject the PRP back into the shaft and the glands of the penis. And PRP usually take about 6 weeks to start to kick in, and full effect is 3 months, and usually lasts anywhere from 9 to 12 months in terms of the rejuvenation process. And sometimes, like I said, if you had it for a long time, there's neuropathy, there's trauma or things like that, you may need multiple treatments to actually prime your tissue to actually rejuvenate. So typically that's how that works.
Yeah, it definitely makes sense. And so is there any, side effects or anything patients need to look out for, or anybody that, you would say specifically not a good fit for this treatment?
Yeah, so side effects are obviously, we're taking a needle and we're injecting into tissue. So there's a vascular tissue for that matter. So for the most common side effect is bruising after the injection at the injection site. And really, side effects in terms of other bad adverse reactions is very rare, because what we're really doing is we're injecting your own
Mm,
bodily fluid or tissue or cells or growth factors that your own body makes. So there shouldn't be any sort of reaction towards that, right? And I would say that who everybody can be a candidate. It's a matter of how effective it will be if you try it. And depending, again, going back to what are the reasons of the ED, that really dictates the effectiveness of treatment. So I would say that we have to normalize a lot of physiologic functions. So oftentimes people that have ED, they also have hormonal imbalance. So we see that a lot. So if you just give them the treatment, it may help. But if you balance their hormone because they have low testosterone and whatnot, and you replace their physiologic dose of testosterone, oftentimes that will help support your treatment and stuff, right?
yeah.
And incidentally, if they have low testosterone, you can give them all the P shots in the world. It probably is a temporary effect, and then it won't be long lasting. So you want to get down to the root cause of the ED, and then sort of treat with that, and then use these type of P shot and other modalities as a adjunct therapy to improve their sexual function.
Yeah, it definitely makes sense. And the testosterone would also help them with that, mental component too, and that desire for it.
Oh, absolutely. So every body in our cell have receptors for testosterone and estrogen, and
Mhm.
especially once you get into your 40s and 50s, both men and women, we actually start to decline in our endocrine functions, and a lot of that is caused by our current environment and modern day stress.
Mhm.
And when those things are at play, it can impede our hormonal function, and then it leads to end organ sort of dysfunction, right? So hormonal health and endocrine health is a very important part of the whole lifestyle rejuvenation process.
Yeah, absolutely. And I thought that was great that you mentioned too that you have older patients too that can still, be enjoying these things too. Because I think a lot of patients might assume that as they get older, they're just going to deal with, a lot of the issues that they're experiencing from hormonal issues.
Correct.
Definitely. And so, how long do these treatments typically last? Do you have, a certain schedule you usually recommend for patients to come back in and do them again, or is that just, on a patient by patient basis?
Yeah, it's usually patient by patient basis, but usually if they have comorbid conditions that we know that
Mm,
can sort of lead to ED down the line, and now they're here and we're able to intervene, I typically recommend that they could probably consider once a year to see how things are going. And some people notice that, by at end of 6 months, 9 months, they notice a difference, then they would just come back and make an appointment, and we'll just do the treatments again.
okay, yeah, that makes sense. And do you usually recommend any other, treatments, modalities that you provide, or any other homework for them to do to really get the most out of this?
Yeah, so part of the treatment regimen for P-shot is we will also give patients a pump to go home with.
Mm,
And one of the things is that you have to train the tissue to actually receive blood. And once we inject the growth factors, you're trying to stimulate the cells. So we typically would recommend them using the pump for a period of 2 weeks or more, and a couple times a day in the first few weeks, so that the tissue is sort of getting used to accommodating the blood, so that you can have a full erection.
mm,
And in certain cases, as we age, we have scar tissue that can form on our penis. So Peyronie's disease is a disease that is in men where the curvature of the penis can get worse when their scar tissue develop. So there is some evidence that with multiple treatments of uh, um, PRP injections and stuff, that can help rejuvenate the tissue, and sometimes can get rid of some of the scarring of the tissue. And
mm,
in that case, we oftentimes will add in shockwave therapy in addition to P-shot, because that can help sort of stimulate new growth and break up the scar tissue, and that can help increase um, circulation, etc. So oftentimes P-shot and the shockwave therapy is combined, and it has a very good outcome.
Mhm.
That's
Yeah,
minimally invasive, I guess.
yeah,
Right.
that makes sense. And so does the shockwave therapy really act to, break up the plaque and the issues causing the Peyronie's disease, and then the P shot is giving, the body what it needs to be able to regenerate and regrow there?
Yeah, I think theoretically that's sort of the concept, and anecdotally and clinically, I know you read on literature, some people doubt that works and some people helps, and in my mind, again, you got to do the conventional medicine and go through a thorough history and physical and practice conventional medicine, and when things are ruled out, patients have options that they could do pharmacologic interventions, surgical interventions, or if they don't want to choose that route, these are the options to try. And some people it works very well, and they're very happy with it. So I think the more options we have to offer patients,
Mhm.
the better choices they can make for themselves. And now with technologies available, some of these things probably is not talked about in mainstream medicine because I hate to be a pessimist, but probably because no one would sponsor the study because there's really not a patent that you really can get to, right? It's not like you can design a new molecule so you can get a patent. So big pharma are not interested in these treatments. But these are viable alternative treatments that if they have no other options they want to try, it probably has minimal side effects, to them.
Definitely. And yeah, like we talked about, for those Viagra and Cialis, things like that, those can work for some patients, but for ones that don't, or if they have other issues, I think it's great that you have these options out there for those patients. So yeah, I completely agree. And in your opinion, when should a patient really be, seeking professional help and trying to find treatments like this? Is there specific signs or anything they can look out for?
Yeah, well, I think the most obvious one is that most people would know what they used to be able to do, and if they realize that they aren't able to do or perform or have an interest, that would be the time to start talking to their doctors about it. And you shouldn't feel embarrassed to bring this up. Most providers and physicians are professionals. We're trained to talk about these things, and this is a very natural part of life. And it's we talk about mind, body, and spirit. Well, sexual health has to happen for us to have mind, body, and spirit in sort of balance. And it's one of these things that plenty of studies suggest that if you have more sex, you're actually healthier. So if you're not having sex, it will impact your spiritual and emotional and mental health. So it is very important to bring those issues up. And those two things usually go hand in hand. If you're depressed and you have anxiety and stress, your sexual function is probably not going to be all that great. So you really should talk to a healthcare professional.
Absolutely, I think that's great advice. And what are some of those symptoms too of patients having hormonal issues that they can look out for that, really just aren't part of that normal aging process?
Yeah, so I would say that if you're fatigued all the time, by 3 or 4 o'clock in the afternoon, you really need to get a big bottle of Red Bull, or
Mm,
you need like 5 cups of coffee, or you just can't function. Those are signs of what we call adrenal fatigue, or there's a beginning of some neural endocrine axis dysfunction.
mm,
That would be signs, and then the brain fog is one. You just can't concentrate as much as you used to be able to. Short-term memory type of issues, and then obviously, the desire to your libido, the desire to have sexual relations and things like that. If those are decreasing, those are kind of signs that hormonally there's something going on.
yeah, absolutely. It's good to look out for. And what would be the best way for patients to get in contact with you if they wanted to come in for a consultation?
Yeah, so they can contact us through Instagram, Facebook. And, we're on there, Glow Laser Beauty, and they can DM us. And our website has a way for them to make an appointment. And we also do televideo consultations. So if they have any questions, they can contact us that way.
Awesome, that's good to know. And yeah, those are the questions that I had for you. Was there any last advice or anything you wanted to leave the patients with if they're struggling with any of these things we talked about and not sure what to do?
Yeah, I mean, my last word of advice is what I started with. Don't be embarrassed to talk about it. This is a very common problem, and it actually we have a lot of treatment modalities, and oftentimes that's one symptoms or signs that there's a bigger health issue that's going on. So don't be afraid to bring it up, even if it's the first thing you notice is that you're having sexual dysfunction. Make sure you bring it up to your doctor's attention because there's other um, bigger things that might need to be looked into. And that's an early warning sign of bigger things to come that we have to take care of. So
Absolutely. All right. Well, thank you so much for taking the time to talk with us today and share the education on those treatments. I really appreciate it, Dr. Lin.
no problem. Thank you for having me.
Yeah, thanks again.